But let's talk about constipation for a minute, because there are some things that people can do. And I always hear this on everything that I'm on. People say, what's the number one thing that people can do to help with constipation?
Mm-hmm.
And it's probably the hardest thing to do, but it's the most simple.
Mm-hmm.
It's simply take the time to chew your food.
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, our next guest, this is way overdue that she is on. I have known Susan Clinton, I can't tell you how long, probably most of my career. And then I remember when she became my friend, and I think I might have told her, I'm like, oh my God, I'm friends with Susan Clinton. But we're reconnecting after a couple of years here. But I've been wanting to have somebody come on the podcast to talk about kind of anything GI, bowel, rectal, because those things come up and not a lot of people talk about it. And Susan's one of the OGs that I learned from. And so hopefully you guys can learn a little bit too. So Susan Clinton, Dr. Susan Clinton, welcome to the show.
Welcome. Thank you. It was my honor to be here and to talk about whatever we want to just get into today.
Exactly. She's like, what do you want to talk about? I'm like, okay, where do we begin? All right. So let's talk just like GI stuff in general before we get kind of rectal and poop and whatnot. I think GI symptoms for women are just, it's not the first thing that we talk about when we talk about issues that we navigate in pregnancy, postpartum, perimenopausal. Where do you think that comes from? And why do you think it's a completely different conversation for women than it is for men?
That's a very interesting question. And it's one that I hear a lot. It's like, mostly what I hear is, why didn't anybody tell me that this was going to happen?
Yeah.
They're completely unprepared for, things that are GI related. And so let's just do the laundry list. The biggest number one complaint is hemorrhoids.
Yes.
And they feel like they're not very well, people feel like that they're not very well supported in their healing of their hemorrhoid journey. Anal fissures is another one, which goes hand in hand with hemorrhoids. And then constipation, of course. I didn't realize that I would be this constipated after birth. I'm drinking water because I'm breastfeeding. But you're not eating any fiber, you're eating a bunch of junk because you're tired and you don't have time to do anything for yourself anymore. There's all of these things that go into it. We forget about the stress of the nervous system, slows the GI system down. Irritable bowel syndrome comes from things like illnesses, fatigue, stress, birth trauma. All of that sensitive gut that goes along with the brain that's racing, feeling like it's running from the tiger all the time, or things just didn't go as planned, or you ended up with a surgery that you really didn't want for and really didn't want to sign up for and really weren't part of the choices. And then, of course, there's the things that actually happen in postpartum and perimenopause and in menopause as we move forward that can be what we call switches for autoimmunities. So when we go through these, women have the opportunity to go through a lot of transition, hormonally, physiologically, musculoskeletally, all of these things, which allows us to have the building blocks and the resiliency to live longer.
Mm-hmm.
We do outlive our male counterparts for the most part. And part of that is that reason, we have that. They don't have that opportunity. There is more of a slow change transition for our male counterparts. But with that comes along some people have certain switches for certain things. Like we know that there's a genetic component to breast cancer. Mm-hmm. We know that there's, genetic components to a lot of different things, but we're learning more and more about autoimmune switches that can happen too. And they do happen in times of transition. So it can date back early enough as to when we actually start our periods. Move into what is the disease of the teenagers, mononucleosis, can cause, can have the resultant symptom expression of IBS, as well as maybe some thyroid changes or autoimmunities could click on at that time. Postpartum is a big one.
Mhm.
Um, rheumatoid arthritis, thyroid, Hashimoto's, and Graves, celiac
Yeah.
can turn on at that point, and just a lot of different things can happen there, and so those all can impact the GI system, greatly. And then, through these years, you might see women with more of a spike of ulcerative colitis, some of the
Mhm.
inflammatory bowel diseases that are out there that can be very well handled. We just need
Yeah.
to know what's wrong and know how to advocate for
Right.
ourselves so that we can get the blood work done and the diagnostic testing done, and then get the support that we need in order to heal, recover, and move forward.
Yeah. I feel like, if you can believe it, Gianni's 14 now and Annalie is 11, if you can believe it. But I very much remember when they were little, having a lot of friends having a lot of GI issues and trying to find a diagnosis, and a lot of them being diagnosed with Hashimoto's and things like that.
Mhm.
Can you go in just super briefly on what some of these are and what are the symptoms? What are the kind of the clinical presentations?
Yeah, sure. So the biggest thing about thyroid is going to be the things that everybody talks about. I am so tired. I feel like my nose is running on the ground. More tired than I should be. Like,
Yeah.
we all experience fatigue. We all experience, oh my God, I just need to take a nap or get a good night's sleep. But this is beyond that. So, weakened fingernails, hair falling out, changes in skin. Oftentimes you might even see eczema come up at that time, like the
Mm-hmm.
kind of stuff on the skin. Drinking lots of water, but not really staying hydrated.
Mm-hmm.
Just things like that can be part of it. And then, the other side of that, especially with Hashimoto's, is going to be, that can trigger widespread pain, you know,
Yeah.
joint pain, and then the tissue changes affect not only our skin, but we have to think about our vulvar area
Mm-hmm.
and vaginal tissues and things like that. Concomitant with that happening, we also experience a drop of estrogen and progesterone in the early postpartum time.
Right.
We've had all this wonderful hormone stuff going on to keep us going and the baby
Yeah.
going and all these things, and we do get the prolactin drop in so we can breastfeed and
Yep.
and do this stuff, but we have a pretty serious drop of our sex hormones
Mm-hmm.
on purpose, probably nature wise, because it's not, we really don't want to get pregnant again. So nature kind of tells us, like, this is the time to not be,
Right.
engaging in that activity. You're not going to
Yeah.
have a period for a while, especially if you're breastfeeding, things like that. Of course, there's myths, and we do know that that isn't protective of
Right.
getting pregnant, but perhaps maybe the idea that things don't feel so good keeps us from engaging in those activities right away. Here's the thing. I think that one of the things we should be advocating for and asking for a lot more is some vaginal estrogen support
Yes.
in this immediate postpartum era. Do we
Yep.
need it forever? No. But
Yep.
but what about the moms who are now, like, we have a lovely generation of mothers that are like having children in their early 40s.
Yes.
And
Yep.
so they're already in perimenopause. They're already
Yep.
having hormonal changes. They're having beautiful children and families, but they're getting kind of a double whammy. They've got the
Yes.
rise and fall of the estrogen progesterone cycle going on,
Yeah.
and they're actually postpartum. And so we really need to consider, like, they may need that vaginal estrogen support a lot
Yep.
earlier than like waiting till you're 50. And I don't think that we should all be suffering. I think that
Yeah.
we know that this works. We've got it. It's helpful for tissue, and
Yep.
all of the protein and collagen that you can eat and all of the
I know.
exercise you can do, because I believe in the cardiac pump as well as exercise of the pelvic floor muscle tissues and hip muscles and all of those
Yeah.
things. All of those are part of the blood flow thing, but we really need to have support for the tissue that has a high affinity for estrogen and
Yep.
vitamin D, by the way, in order to be able to stay healthy and thick and not be thinning and painful and sore, and having all this transference of the different kinds of things that are in the vagina and that are in the urine and that are transferring back and forth, giving us very itchy
Yep.
undercarriages and very
Yep.
painful bladder infections. And this is one thing that we can do. It's so safe, and
And so easy. Yeah.
yeah,
A
safe.
little messy, but easy.
so are lubricants and all these other things, right? But this one really actually turns the tide, which is
Yeah.
really important. And doesn't have a systemic uptake, not the kind
Yep.
that they really, because the prescriptive ones are like, I think they're 0.3 or 0.03. I can't remember
Yeah.
the
It's
exact
not
number,
much
but
of
they're
anything.
very
Yeah.
low. I
Yep.
don't think you get a systemic effect until you get up to like 2 or 3 or something
Mm-hmm.
like that. So, and no one is doing that.
Yeah.
However, if somebody is really super concerned about, I don't know, they have breast cancer in their family, or they just really do not want to do this, or they maybe have had a cancer experience and they're
Mm-hmm.
in survivorship, then, the next step is like maybe hyaluronic acid, or, a nice suspension, that has that, or even DHEA.
Yeah.
Most of the oncologists are in favor of like, well, really, it takes research 10 years to catch up to
Right.
clinical application, but
Right.
many of them are not opposed to DHEA, as a lubricant that has that. So those are some of the things to watch out for there. You don't have to have that, and if you're having like, a couple of urinary tract infections that you never had before,
Yep.
that could be a sign of thinning, of the tissue a little bit, and will get better as your hormone levels come back up on track. But
Yep.
depending upon where you are, it may take a while.
Yeah. No, I feel like that's where opening up a lot of those conversations in perimenopause and menopause and reflecting back to the lactating mom where it's a very similar low estrogen state. I love that those kind of, excuse me, parallels are kind of happening. We had Sarah Paramuter on. She talked about the lactation paper that she had started. And then obviously Rachel Rubin is close here, and she's like the queen of vaginal estrogen. So yeah, we're
Yeah.
lucky here that we have a lot more providers where I feel like I don't have to go in and educate and, hope that they prescribe it, but that if a patient asks, it's not a big deal, which is really nice. So yeah,
Yeah.
that's been a big change in the last couple of years, just people being open to it for sure.
And pain, and it's still requiring people to advocate for themselves,
Mm-hmm.
unfortunately, because the
Yeah.
system just isn't set up for that to be the
Right.
immediate thing.
Yeah.
So we still have some work to do there, but that's why a podcast like this is brilliant, because people can listen and go, how do I do this for myself? And I was like, go back and
Yes.
listen to Dr.
Yeah.
Rubin's podcast with Carrie,
Yep.
because I'm sure she talked about myalloid, so
Yep.
there's
Yep.
ways for people to get help if they don't have somebody immediate in their
Yeah.
area.
Yeah.
And we
Absolutely.
can certainly guide them to that. But the other things to think about, people talk about, these markers coming on, heel pain and Achilles tendon pain is
Mm-hmm.
not uncommon in postpartum, and can not always, but can be an indicator that maybe perhaps they've got some sort of systemic inflammatory thing going on.
Mm-hmm.
Why it's heel pain, I don't know. Nobody
Yeah.
knows. But they have likened that to fluoroquinoline's antibiotic use. They've likened it to like a change in drop. And we see tendinopathies a lot in menopause and in
Yeah.
perimenopause. So it could be just as simple as that, but it also could be something a little bit more. So a full blood panel I think is always recommended in the postpartum area, especially if you're having issues, because
Yeah.
blood sugar stuff can be happening there too, like
Yeah.
blood sugar dysregulation, maybe not full pre-diabetic, but blood sugar regulation can create problems with pain and tissue changes and
Right.
constipation, and really run constipation and be part of the story there.
Yeah,
So
let's dive into constipation because that's one that even if let's say you didn't have it going into pregnancy and maybe you experienced it a little bit, I have so many clients that just that's one that really that and like fecal soiling and things like that that just takes people by surprise. And I think because it's not something you're going to readily talk about, even with your postpartum friends, like what what are kind of some of the typical presentations of postpartum constipation? And then let's talk a little bit specifically too about a lot of people don't know what fissures are, and a
yeah,
lot of people don't actually understand what hemorrhoids are. So maybe we can kind of do the basics on those and then kind of dive a little bit deeper.
yeah, absolutely. So let's start with the first thing that happens is tearing.
Yeah.
So the gold standard, of course, is if you have a tear deep enough to go into the anal canal. And we're much more on board with this now, that clean up and right into the surgical suite we go to get that repaired.
Yes.
The gold standard. However, we can have micro tears and we can have changes and we can have hormonal changes, we can have nutritional changes, we can have stress changes. Whenever we have stress, and I'm, having a baby is wonderful, but it can also, your nervous system changes because
Mm-hmm.
you're not sleeping as well and you're more attuned to what's going on with your new child. And there may be others rolling around in the house too. And, so all of these things can create kind of the havoc, but the pressure and the pushing and delivery oftentimes will, trigger hemorrhoidal development. And basically hemorrhoids are nothing more than a prolapsing coming outside of the anal sphincter of a hemorrhoidal vein.
Mm-hmm.
So we have veins in our anus and they're called hemorrhoidal veins, and they can start to get big with pressure on the inside, and then when they get more pressure and they get big enough, they poke out the hole.
Mm-hmm.
Right? There's a pressure differential, so it takes a lot of pressure to get that to happen and to come out. And when it does, it can be very painful because they're quite tender,
Mm-hmm.
and it hurts to touch them, it hurts to sit on them, and it really hurts to have a bowel movement.
Yeah. Yeah. No, and I think for people who've never had them before and then they have them in pregnancy, and then sometimes they're better, sometimes they're worse.
Mm-hmm.
And you're being told, oh, it'll get better after you stop being pregnant, and then they're worse. Like
Right.
then moms don't know what to do. And I think a lot of people don't necessarily think of kind of all the possibilities and even pelvic floor as being, kind of a factor in all this.
Right. Because when we have pain in that area, we're going to have a concomitant or we're going to have an over response of the muscles in the area too. Because just imagine when you hurt somewhere, the muscles are going to kind of tighten up to protect it. And that just makes it worse.
Mm-hmm.
So learning how to can I relax? But what if I relax? What if it feels bad because it hurts right now?
Yeah.
What do I do? Do I do this? Do I not do this? Do I push through and have a bowel movement? Do I not? So the first thing is first aid. Always first aid. You need to get the right topical, and it needs to be one that goes inside as well as outside.
Mm-hmm.
I can't emphasize that enough because
You gotta go in there.
before 1980, we didn't call them hemorrhoids, we called them piles. And because they pile up from the inside out.
Okay.
You want to just have that lovely little graphic in your head. So it's like, rather than dealing with the end piece, we need to go back to the root of the problem and shrink those things on the inside. So really communicating with your doctor, because they may just say, give you people go and you can buy the stuff over the counter and those can be somewhat helpful, but you need to do something from the inside out. If the regular stuff from the drugstore doesn't help, then call your physician and get something else, a little bit more prescriptive for you.
Yeah. No, I think that the next step that I hear a lot from clients, they've tried those things, they haven't gotten help. And then, and even early, I've seen this early on where patients are like, you know what, they want to band it. What is that? And what are the typical outcomes of that?
Yeah. So banding can be for the very stubborn hemorrhoids that are not responding to anything. And it could be that they're prolapsed so badly that they're just not going to shrink and they're always going to keep getting inflamed. So they have a bowel movement or they're a bit constipated. So they push or they strain and then it gets inflamed again. It's hard to keep it always clean. When you go home, you get that little peri bottle and people use it for 1 or 2 days and then they quit using it. Don't stop using it. Keep using it, especially if you have these, because you need to keep the area as clean as possible. But what they do is they just go in and they just tie stricture, like what you would do for stitches.
Mm-hmm.
They go in and they put that on there. In some cases, they might even use a little bit of laser, to get them. But what they do is they band them so that they will fall off.
Yep.
Right. And they do that so that there'll be an end piece to it, but they're taking the piece that just won't shrink, or it shrinks, but it's still there and it won't regress back in. And it continues to become inflamed.
Yeah.
So,
yeah. I think the other thing that goes along with that too is people think, oh, I've got it taken care of. But if they never kind of address the underlying issues that sort of got them there in the first place, the other kind of space and place I'm seeing this now too are all the perimenopausal women that are being told to, eat the number of grams of protein as stars in the sky, and so they've pumped up all this protein and they haven't increased their fiber and they're constipated as heck. And
Mhm.
then that all of a sudden brings on these kind of old dormant hemorrhoids and it just gets worse and worse. And if they don't kind of stay on that part of it, it just becomes this like
Right, and then we
cycle.
have tissue that's changing and thin,
Yeah.
and they don't have strength in their pelvic muscles and in their hip muscles,
Yep.
and so it's like and we can't underestimate the power of the tissue that holds the muscle together and the tissue that
Right.
holds it all to the bone, what we call connective tissue. But connective tissue requires not just protein to be healthy.
Right.
It requires this estrogen piece, this hormonal piece, but it really requires vitamin D.
Hmm.
And so people don't think about that. And maybe and it's easy to, when you do a blood panel, ask for your vitamin D too
Hmm.
and be sure it's there because it could be quite low. And if it is, you need to bump that up. Good, healthy green vegetables are part of it, but some people need to supplement D3 plus K2 to really
Yeah.
get that up. And that's important for bone health as well.
Yeah.
And we want to, at this age, continue to be building our bone health because as we do make that final transition to where we are no longer going to be dependent upon or using estrogen in our life anymore, 1 year between your last period, since your last period, you're there. We're going to lose at least 10 to 15% of our bone.
Yeah.
Just no matter how good we are, we're going to lose that.
Right.
So we want to be really good
Yeah.
before we go into it, and we want to make
Yeah.
sure that we're getting, which is, and I know you're really big on this. Let's get strong. Let's move,
Yeah.
right? That's because that builds the bones too, as well. But let's talk about constipation for a minute because there are some things that people can do, and I always hear this on everything that I'm on. People say, "What's the number one thing that people can do to help with constipation?"
Hmm.
And it's probably the hardest thing to do, but it's the most simple.
Hmm.
Is simply take the time to chew your food. And we have studies on this. We have studies on this, that the amount of time chewing your food matters. They did
Mm.
studies on chewing almonds, and they looked at 5 chews versus 20 chews versus 40 chews.
Mhm.
They knew that there would be a difference between 5 and 10 or, 5 and 20. They knew that, right?
Wow.
And there was. What they didn't know was how big of a difference there was between 20 and 40. And they looked at all of
Wow.
these gastrofunctional, indexes and things to see when this started to happen and when the stomach would empty and when these things would go on.
Mhm.
And it just made such a difference that this whole thing has been always around advocating chewing your food. I mean, I heard that since I was a child. Grandparents have said it, they've been saying this for years and years and years and years. And the more cognitively developed we become, the less we do that kind of stuff.
I think we're distracted too. I mean, like I'm thinking postpartum, like you're having a corner of a grilled cheese sandwich with a toddler,
Mhm.
and then now like I turn into a chauffeur at about 4 o'clock, and so you just grab when you can. But is
Mhm.
it the idea that there's more surface area of the food?
It has everything to do with the mastication,
Mhm.
and the salivary, L-butyric acid that comes in with
So you're
that.
making more because you're chewing
Mhm.
longer. Oh, interesting.
Your
Okay.
salivary glands are going to perk up if you chew, right? And everybody knows this. When you think about, like, we have this ingrained, this is why our brain's so important, because when we think about something that we really want, we actually start salivating.
Mhm.
Pavlov's dog, the whole thing,
Yeah. Oh,
ringing the
that's
bell, the
interesting.
dog was just like associated with the food coming in, would just
Yeah.
automatically be ready to eat it.
Yeah.
But the important thing is the butyric acid that comes from the salivary glands when we chew our food.
Mhm.
Is really super important to turning on the acid pumps in our stomach.
Mm.
And
Okay.
we have to have those acid pumps turned on, or else, we're not going to get the minerals through our stomach lining that our
Mm.
bones and connective tissue and muscles need.
Okay.
So we lose a big part of that if we don't chew our food and get that
Got it.
stomach going, right? So that's a big one. So now we have really good digested protein going into the small intestines where they will start taking care of the fiber, and they'll start taking care of the fats, and they'll start
Mhm.
taking care of the carbohydrates. You get the stuff all pumped in there. But
Mhm.
what we don't want is undigested protein going down there because it's going to
Yeah.
clog everything up and slow everything down.
Yes. Yes. No, absolutely. And that's, I mean, when I talk to people about constipation and just anything digestion or food related, I'm like, we've got what we eat and then the transit and then the output. Anything else in this top part that you feel are like things that people miss or myths that people have that just aren't true as far as kind of what they eat or how they eat?
Hmm. So I, there's there's always going to be subcategories of different things, and there's a
Hmm.
category of people who just can't eat solid food very well. But we're
Hmm.
talking to the 80 to 90% of us that are running
Yeah.
around here.
Yep.
So one of the biggest myths is that it's okay to be distracted as long as you eat. Doesn't matter, just so long as
Mm.
that's not really true.
Hmm.
How the conditions under we eat, and there's been many studies on this, affect how we digest our food.
Okay.
So if we're under stress, we're going to slow our digestion down. Why?
Mm.
Because our stress part of our brain says we don't have time to eat or to digest right now. We
Hmm.
have to do this other stuff. And it's like, I can chill out and eat in the car and, while I'm driving. Well, not really. No, you can't. The number one reason people get into motor vehicle accidents is distracted driving. And
Yeah.
that means eating while they're in the car driving.
Yeah.
So we don't want that. So there is a stress level there. Don't tell yourself the story that it's not.
Okay.
And what what your environment is like.
Yeah.
So if you have to eat in the car, maybe you could eat the first moment you like stop the car and
Hmm.
be quiet and chew some of your food and eat
Hmm.
quietly. You may have to split it up over the stops. Like if you're going 3 or 4 places, that happens.
Yeah.
But really trying to find that time where you can at least, I would take 5 minutes of quiet eating over, 15 minutes of distracted eating any day.
Mm. Yeah,
You know,
for us, it's eating in front of the TV or eating scrolling. I typically don't eat in the car because I have a stick shift and I don't have enough hands. But yeah,
well,
like I
so
mean, it's so
environment dependent.
hard. Yeah, no, and I can totally see that, and it's all this stuff that I'm kind of thinking about the kids too. It's like, yeah, we just get used to even as a kid, we would sit in front of the TV and watch the 6 p.m. nightly news and eat our dinner. I'm like, oh gosh, we
Mhm.
were distracted even then.
Exactly. And so that's another thing. D- Having those difficult conversations
Mm,
and or watching something that is stressful is not a
mm-hmm.
good thing. You're way better off turning on a book on tape that's something
Oh,
that
we
you're
stopped the news.
I mean, even some of the TV is not
Yeah.
good. Like even
Yeah.
if you're not watching the
Yep.
news, there's a lot of reflection of society in TV,
Yeah. No, that's
and
fair.
things like that can be kind of, everybody's system is different, but mealtime is meant to be celebrated and enjoyed together, and
Yeah.
not meant to be the time when you're having a discussion about the bills and when things are, this or that,
Yeah.
any of those uncomfortable situations or whatever happened at work today or whatever, any of those things should not happen at the mealtime.
Yeah. All right. Well, while
So
you're working on that, we need to chew, people. I haven't had my lunch yet, so I'm gonna make sure that I chew this afternoon. I'm gonna channel my Susan and
100%.
chew.
The other thing is that is fiber, and let's just talk about that a
Yeah.
little bit, because there are many, many, many types of fiber.
Yes.
And so, what is the best fiber? The unprocessed fiber is the
Hmm.
best fiber. And so, all these bars that have sugar and all these other kinds of things in it, oh, but it's got like 8 grams of fiber. And it's like, you'd be better off, just having, like a tablespoon of flaxseed or chia seeds than you would be
Right.
doing that. So
Yeah.
there's all kinds of ways to get fiber in. There's, you know, vegetables, even people who are staying a little bit more keto, you still need to eat vegetables. We still have to have them. There's still that
Hmm.
many important things that come out of them. The less processed, the better,
Yeah.
right? If you have a stomach that's very sensitive, cook them, you
Yeah.
know, steam them, grill them, do something with them so that they're partially digested and they're easy to do. Chew them,
Yeah.
like, to make that better for yourself. But anything, so, and other fibers that can come in are all good. Like there's psyllium fiber, there's brown rice, there's brown rice flour, there's all these wonderful things that are less processed. But
Hmm.
here's the deal: Do not add fiber all at once.
Yes.
When you feel like I'm
Yes.
constipated, now I'm gonna go take 3 fiber pills, or I'm gonna go I'm gonna put a big bunch of psyllium fiber into my smoothie
Yeah.
today, and now why am I full of gas and bloated and I don't feel good? It's way
Mhm.
too much.
Yep.
So, like, if you're increasing your protein, and I love that you brought that up, you definitely need to increase your fiber too.
Yes, very
And
much so.
and you need to increase your water, and here's the thing,
Yep.
busy people tend to do one of 2 things. They chug all their water in the morning,
Mhm.
'cause I wanna get it down and then I have it for the day.
Yeah.
Or they wait until the evening to chug it all, and then they're up half the
Right.
night going to the bathroom.
So sip.
Yeah.
I'm a sipper.
And here's the reason why. Physiologically, this is why it doesn't do you any good to wait and hydrate, or to, hydrate all at once.
Mhm.
Because if we hydrate too quick and have too much coming in, it doesn't go to our GI system anyway.
Mm.
It doesn't go there. It gets dumped right into our urinary system.
Yep.
And so if you're drinking that kind of water and you're peeing every 30 minutes or 15, 20
Yeah,
minutes
that's
for a
not
bit,
helping.
no, then you
Yeah.
understand that that is not going to work for you.
Yeah.
So that's why we say take it, and you don't need 2 liters of water every day.
Yes.
The
I
research is
feel like
getting more and more and more clear that we're really way overdoing this bit a little bit.
yeah. I feel like we're, at least here in the States, we are like a country of extremes. We either like under hydrate or not take
Yeah.
enough fiber, and we think we do more than we actually do. And then that's why I love people doing like an actual log. I'm like, we need to see in black and white, because you think you're doing this and you're not. I can guarantee it. Or they overdo because more is better, because it's the United States. So the other thing that I see I wanted to ask you about is, lots of times people will, talk to a provider about fiber, and the provider will be like, oh, well, just take a couple scoops of Benefiber, not realizing there's not actually that much, or like take one of those gummies, there's not actually that much fiber in
Mhm.
them. And
Right.
people are really surprised when they look at that. I'm like, you're only going to get like 2, maybe 4
Mhm.
if you're lucky.
Right. Right. And I think it's because it's easy.
Yeah, I suppose you're right.
Right? So people, they try to just do this, it'll be easy. Here's the thing. Number one thing, if you're terribly constipated, you're going to need some sort of an osmolytic to get things moving.
Hmm.
So work with your physician. Generally, it's something like Miralax. It's not
Yep.
forever. It's not forever, but you need to do that consistently to get it going.
Hmm.
Right? Once you get it going, then you can start to see, do I need it every day? Or do I need it twice a day? Maybe I can
Right.
bring it down a little bit. And for those of you who are going to do something like that, look at your body. If you weigh 100 pounds, you don't need a full scoop of Miralax.
Yeah.
Come on, right? I'm always like, start easy, like be gentle to yourself. We don't need to have bombs going off.
But if we do twice as much, it'll get there faster.
Yeah, we'll just start this up and down kind of processing
Yeah.
where, okay, we need it to poop and then we don't need it for a while, then it all builds back up and then we need it again.
Right.
What we're looking for is consistency with the GI system. It's a very consistent organ. This is why it doesn't respond well in stress, because it's very slow to change lanes.
Yeah.
Once it changes lanes, it's very slow to get it to unchange that lane and come back into a new one. So we
Yep.
have to be gentle with it. We have to be consistent. That's why you've got to pay attention to your brain as well as your body
Yeah.
with GI stuff, because there is the gut-brain connection.
Yeah.
And and all of the happy juice we need in our mind, like this, if people have heard about serotonin,
Yeah.
and those types of things, and dopamine, like a dopamine hit, makes you feel,
Yeah.
oh, yay, good. All of that, the serotonin, 95% of it that our brain needs to function at a high executive level is manufactured in the gut.
Mm,
If we're terribly constipated, our gut is way slowed down, and we're stressed out, we're not getting the
yeah.
serotonin manufactured for ourselves that we need. So I know this all goes back to sleep a little bit too. What's another easy thing you can do? I'm not saying sleep all night, because I understand newborns, I understand toddlers, and I
Hmm.
understand teenagers. And, it's a different type of thing. Like with little ones, you have to be there for them physically all the time. Older
Hmm.
ones, it's a mental game. You got to be one
Hmm.
step ahead of them. But the thing is that there are times where you can really get optimal sleep. And so if you
Mm-hmm.
can spend the time between the hours of 10 p.m. to 2 a.m., whatever you can capture in there, you're going to get the best deep sleep and
Mm-hmm.
you're going to get the best production of human growth hormone, which is going to pick up and get the serotonin manufactured out of the gut and get things happening.
Mm-hmm.
You may have to wake up to feed. You may have to wake
Yeah.
up to change somebody or put them back to bed or do whatever has to be done. But at least you're optimizing a good piece of that time in that those hours that are critical. And
Yeah.
this goes, I don't care where you are in the world, it's all circadian rhythm. And the
Mm.
GI system functions well with a well-functioning circadian rhythm.
Mm-hmm.
So when you are up in the morning, open the windows and get some sun in your eyes,
Yep.
breathe some air, move for at least 5 minutes
Yep.
so that you can get everything going and then see how much coffee you need. Rather than coffee dictating the next step you're going to take. Right?
Valid.
Yeah.
Valid. I don't think I started drinking coffee until after, I think maybe Annalia was like 2 or 3 or something. And so, but it's nice not to have to like eat it. That's good. All right.
Or just be
Talking.
able to judge how much you need, with a
Yeah.
mindful approach to it.
I am also that girl that I can throw an espresso in the afternoon and go lie down and take a nap. So it's a strange thing, caffeine. A question that I had for you about stool consistency,
Mhm.
because I think a lot of us, are pretty well versed in, we don't want rabbit pellets, we don't want diarrhea, we want something kind of halfway in between. We've got, a soft snake or whatever. What about when we're trying to work with that postpartum client that may have some sort of birth injury and maybe the beginning of the stool is good and we've gotten them to the point that like that first 3/4 of the stool is good. And then the end is just kind of mushy and hard to kind of close off.
Mhm.
And maybe like it's hard to get like little smooshy things out after that we don't really have a fully formed piece of stool. Like,
Mhm.
what causes that, or what are things that we would need to look at? And then what are some possibilities as far as trying to address it?
Yeah, so that's a great question. Here's how it goes. The first stool you have is good. Maybe not the end of it quite so good. The next one you have is really broken and messy and maybe has all those little pellets in it too.
Mm-hmm.
But you're starting to think that it's diarrhea,
Mm-hmm.
right? The third time you go, it's pretty runny.
Yeah.
And then the rest of the day, you're itching and you're worried that maybe a little bit is leaking out.
Mm-hmm.
So this particular situation is what we call washout diarrhea. I mean, washout
Mm.
constipation,
Constipation. Yep.
right? And so think about a rock pile and then pour water on the rock pile and see
Yeah.
what happens. So all of that stuff comes around the rock pile and and comes out the rest of the day because we're continuing to make the liquidy part of our stool on the other side of our colon. And so when we go to the bathroom in the morning, where some of the stool from the sigmoid is coming out, that's the place where it's really held.
Mm-hmm.
But it's backed up so high, it's up into the descending colon.
Mm-hmm.
And the job of the descending colon is to remove water.
Mm.
Stool. So the longer it sits there, the harder it gets.
Yep.
And so that's where all those little pieces and things keep coming from because they
From the rock
eventually
pile.
the rocks come down, right?
Yep.
So that is the biggest challenge with that type of situation.
Mm-hmm.
And so this goes back to craft a better stool.
Yeah.
To your food, balance your protein and fiber, slowly drink your water, do some sort of osmolytic to begin to break up that rock pile and get it consistent again.
Mm-hmm.
And, this is why I say start slow with it and kind of build up.
Mm-hmm.
Or, if you wanted to work with your physician, if you really feel like that you're badly backed up, but most people think that if they have a bowel movement in the morning, they're not constipated, which
Right.
is from the truth. So work with your pelvic PT because they can help you feel your descending colon and know you're backed up. Get a flat plate x-ray. It'll show the stool burden in there.
Yep.
Your physician can do that for you very easily. So there's ways to know. Sometimes people need to have the evidence to know that
Yeah.
they do the treatment plan. But here's the
Yeah.
thing. Whatever you're going to do as you're working together, be consistent.
Yep.
This is not a 3 days and I'm done with that.
No, it's
This is
not.
not a
It's
2 weeks
not.
and I'm done with that. This is months.
Yeah.
This is months.
Yeah.
You get on the train and you stay on the train. You do not get off at the next stop. Maybe something else can come onto the train with you, but you stay on that train. And it's
Yep.
got to be, this is the thing. No one's ever really handed like a plan.
Yeah.
And I can tell you that now, no matter what it is, you got to stay with it long enough to get it to work.
Yeah. No, I think that's such an important point, because a lot of, like, the average person thinks, oh, I pooped, I'm not constipated, and doesn't understand that whole backing up. Any of
Mhm.
us that have navigated constipation and bedwetting with our kids, I learned more about that having a
Mhm.
kid with bedwetting and then taking that and applying it to some of our adults. Like, yeah, if it's backed up, you got to take the time, and you got to have the consistency over months. And I think
Mhm.
it's important to be upfront about that commitment. It's like, this is
Mhm.
not you do this 2 nights and you're done. This is like, we need to
Right.
change the whole system and get it used to doing something different. It's just going to go right back to what it was doing before.
Right, because remember,
Um,
it doesn't like to change lanes. It's very slow.
yeah.
It requires love and consistency. You got to
Hmm.
love yourself and love your gut. You have to. It's not going to work otherwise. It's
Yeah.
failed. It's already been abandoned, and it doesn't believe you. No, but whatever stories you want to put on there, but you got to accept and
Yeah.
love and bring it back onto the table, and you're going to have to hug it every day and
Yep.
nourish it every day and do these things
Yeah.
that
Yeah.
can be,
Which,
so helpful. And
well,
for that, yeah,
yeah.
so go ahead.
No, I was going to say, and I think that's hard too when you're trying to navigate this as a mom, because all the attention's going on the baby. And even like later on, when you're trying to do, I definitely feel like perimenopause is like postpartum 2.0, where you got to do the protein, and you've got to do the resistance, and you've got to, do the zone 2 and this and that. And it's like, okay, and you want me to do what with my stool and my eating and chewing, and like the list of shoulds, and trying to figure out the prioritization, I feel like
Mhm.
is a lot.
So
Um,
I love to tell this story. First of all, I'm going to say the other reason for constipation changing is as you get into perimenopause, since you brought it up,
yeah.
it's the number one driver behind this urgency frequency thing.
Yep. Yep.
So clear up the constipation, that starts to get way better. Yeah.
Yeah. Always
So
start with the poop. That's one of
yeah,
the first things you taught me, is like, all about the poop. Get it cleared up first.
well, because it's the low hanging thing. It's the one that
Right.
if you get that straightened out, most everything else gets straightened out.
Hmm.
So here's the thing, especially in the land of the shoulds,
Yeah.
we always need to, and I want to empower everybody here to think about this. So I've been learning how to paint and, spending time with people teaching me different things. Here's the number one thing I learned. You do the background first, and before you even do the background, you tone the paper with whatever background
Right.
color you
Yeah.
want.
Yep.
Then you do the background, and then you do the next piece of the background that comes forward. The details do not come in until the very,
Very
very,
end.
very end.
Yep.
And they're so easy to do at that point because everything else is done.
Right.
The picture just comes straight out at you. Our
Yep.
health is the same. Look
Mm.
to the foundations of your health first, because
Yeah.
it doesn't matter what hormone replacement therapy you're on. It
Hmm.
doesn't matter if you're going to take thyroid medication or not, or whatever these details are.
Right.
If the foundations of your health are not being tended to,
Hmm.
then you're not going to be getting the benefit from the other stuff that you need.
Yeah.
So those basic tenets that you talk about all the time, Carrie, of sleep and nutrition and movement.
Yeah.
And, first you've got to get those in. Then you can
Yep.
talk about, can I lift a little heavier? You got to be
Right.
moving
Yeah.
first. You have to be sleeping enough to get some movement in. And you don't have to sleep all night. I'm not saying you have to have an
Yeah.
8-hour sleep. I'm saying, can you optimize your deep sleep a little bit?
Yep.
And you start
Yeah.
making some changes. Can you get your circadian rhythms in check?
Hmm.
Can you grab a banana instead of a granola bar,
Yeah.
or something else. I mean,
Yeah.
some people, I've had so many people who are like eating fast food. And the first thing they say to me is, well, I've heard that bananas aren't good for you. Should I eat this banana? And I'm like, really? Why don't we start with like what we can eat instead of McDonald's,
Well, and that's the part that I think, like, if you step back and look at, like, people are worried about eating fruit because there's sugar in it. And I'm like, okay, what? Like, where do we fall off the track on that one? Like, getting like high fiber cereals, not very sweet. Throw some berries in it. Guess
Yeah.
what? Great source of fiber too, and they're delicious.
Or
And
dates.
no, it's not going to kill you. Like,
I pick up a date, and add it to your
oh, I
sauce.
love dates.
Like that,
Yeah.
and they're full of. So we need glucose. So this is the biggest thing
Yeah,
about it.
it's not the
We
devil.
need
Yeah.
glucose. Our brain has to have glucose to live, which
Mhm.
is why when you're tired and you're cranky, you eat everything in sight
Right.
because your brain knows it needs glucose. So it's going to, and
Yeah.
it's not a willpower thing, it's a survival thing.
Yeah.
So, but it's processed stuff, the processed
Yeah.
sugar. So if you need to have something super sweet, I don't know, then do a little maple syrup.
Yeah.
It's not going to be the end of the world, but it'd be better than just doing the white stuff.
Yeah.
And if you want to have a cookie at Christmas, then have the damn cookie at Christmas.
Yeah.
But here's
Yeah.
the thing. My deal for people is, when they're really working on like, okay, I'm trying to do this and trying to do this, but I really want, it's my birthday, and it's like, make that experience the experience of your life.
Mhm.
If you're going to have a piece of birthday cake, by gosh, make it be the best thing that you've
Yeah,
done
make it good.
in years.
Yeah.
Right? Get with everybody and celebrate and like turn it into something big and get rid of the shame around it.
Yeah.
Because the stress around eating something that brings you total joy shouldn't be there.
Right.
Do you need to do that every day? Well, turn your teeth brushing experience into a joyful experience.
Yeah.
There's all kinds of ways you can do that, but just be super mindful, I think.
Yeah. No,
And
definitely.
those things get into place. It's going to be easier to ascertain if I need to get a little bit more progesterone to make my sleep better or whatever, or to help my vasomotor symptoms of flashes and night sweats. But if I'm eating and I'm not eating a bunch of sugar and I'm not drinking a ton of alcohol, I bet my night sweats are going to get a ton better already.
Yeah.
And then what else do I need to do to add on to that?
Right. No, it's like we skip over the basics of it, and that's something that I've really tried to focus on, especially with moms trying to get back to exercise at any stage, whether it's postpartum or perimenopause moms that are like, hey, my kids can finally take care of themselves. And I feel like I should do X, Y, and Z. And I was like, what do you love to do? Start showing up there first, where you have a community, people you surround yourself with, or maybe it was a class you used to go to and you haven't been to and you love that teacher. Like, go do that first. Let's just build that consistency. And then we'll figure out from there, what are things that you specifically need to kind of fill in those gaps. But I'm like, all this should stuff, like if we don't show up, it doesn't matter. Right. If those basics, that box isn't not checked, it does not matter. And the only way we're going to keep doing stuff is if we have that inner drive to be like, hey, this makes me feel good when I go, or I feel, there's something that we get out of that when we go. Or when we eat that or whatever. Same thing, like a birthday cake. Oh my gosh, when the kids were little, you go to the same party at the same place every weekend. It's the same trashy pizza and it's the same awful cake. And at some point you're just like, no, I'm not eating that cake anymore. And you don't have to because it's crappy cake.
That's exactly
Save it for the party with a good cake.
Exactly. I mean, I'm going to a family thing at the end of April, and it happens to be the first day of it happens to be on my birthday. And I've already told him, I said, I'm bringing what I want.
Yeah. It's your birthday.
Yeah, because I'll be in Austin, and I know that there's several gluten-free dairy bakeries that I'll be able to go
what
to.
bakery you want. Yeah.
Cupcakes, I'm in charge. Thank you very much, but I'm going to bring it.
I like that.
And everybody's like, okay, great. Let's stress for out. Trying to figure out what you can do, so.
Kill two birds with one stone. I love that. All right.
But
One other.
Also say, oh, it's my birthday, but we're not having anything. So, I mean, why would I do that? I want to have fun.
No.
I want to have joy, right? So
absolutely.
It's okay.
Oh, I like that.
To be joyful.
All right. Another one that comes up a lot are questions about bloating. What causes bloating? We'll go in general. And then what are things that people can do to understand kind of why their bloating is happening and what they can do about it.
Mhm. So in the postpartum world, let's see if we can kind of simplify this because it
Yeah.
doesn't need to be complicated. We already have a soft belly, and I'm not shaming the soft belly at all. But when our bellies are hard before we deliver,
Mhm.
and then the thing that was pushing the belly out and the muscles were strong around that baby, and because it was growing slow, even though in a blink of a human eye it's growing pretty fast, but it's 9 months is a slow burn.
Mhm.
Those muscles have lined up to work in that length relationship around the
Yep.
baby. We have the baby, and our muscles now are still muscles. They can still work. They just can't work unless they're lengthened,
Right.
right? When that happens, we still have to get up and pick up our baby and move around and do things. So we have a change that happens where the diaphragm actually is like it takes a deep breath in and it kind of stays there, and then it just moves a little bit
Mhm.
because it's trying to act like a postural control muscle that the abdominal wall can't do right away.
Right.
Okay. And it's the same thing that we see with people with chronic low back pain.
Mhm.
Bellies aren't working well, and the diaphragm is overworking too hard. And we call it an inspire position, where it just means that it comes down and it locks down. It's still working, of course, we're still breathing, but it doesn't have this beautiful excursion that it should have
Yep.
because it's too busy trying to work this other way. So when you have that, it's like everything on the inside starts to fill out. It's kind of like if you see a river dump into a big wide bodied area, the
Mhm.
water kind of seeks that level ground.
Mm.
So we have a lake. And
Mhm.
then at the end of the lake, there should be a river again. And there's no push to the lake to push it
Mm.
to the river. Okay, so that's the problem, is that we have a diaphragm that's kind of created this lake, and then we don't have the muscle activity and the diaphragm activity to actually create the pressure enough to push it through
Mm.
to have these bowel movements. So we get
Mhm.
this bloating and distension
Gotcha.
thing that goes on. The other reason that we have it goes into the IBS part of what we were talking about earlier, the
Mhm.
irritable bowel syndrome. We have sensitivity of our gut. Our gut organs are very sensitive. So we have normal stretching in the
Mhm.
lumen of our gut. That's normal. Everybody has gas. Everybody has, fast racing, stuff. Everybody's got these things that happen.
Yeah.
But for these people, their GI system is oversharing. Most of us
Mm.
walk around and, we don't feel everything that's going on inside of our organs. For these people, they feel everything that's going on in their
Mm.
GI system. They feel things moving through, they feel the gas, they feel the stuff. It's painful. When we have pain, our muscles do one of two things. They either tighten up and hold, or they let go and move away.
Mm.
So in this instance, the abdominal wall is being inhibited by the brain because it doesn't feel good.
Mm.
So so that just relaxes out, and it relaxes out a little bit more because it hasn't been had the chance to be brought back on and get
Right.
back in line with shorter sarcomeres and different physiology things that happen to the muscles as they
Mhm.
kind of slide back up and
Mhm.
slide into a pre-pregnancy type of structure that they were before, which they
Mhm.
can do very easily. So that's basically what it is, generally brought on by constipation, but also by this other brain piece with the stress, and the things can make us feel lousy in our gut. And
Mhm.
so we have to work on both things. We got to get
Gotcha.
in the head and take care of that piece,
Yep.
right? That you came into with the joy, and what simple movement can you go do?
Yeah.
If postpartum, if it was there's nothing wrong with doing a little bit of compression
Mhm.
around your area. I'm not
Mhm.
talking about wearing a very tight, restrictive, waist making kind of thing.
Right.
If you feel better with a pair of Spanx on, or just a
Yeah.
little tighter fitting yoga pants or something,
Mhm.
then do it. It's going to be supportive for tissue that just doesn't have a lot of support.
Yeah.
If you're really uncomfortable and those things hurt, then we need to really figure out, okay, what can we do to help you nourish yourself? What foods bother you? What foods don't?
Mhm.
We got to get on a plan and stay on it. Can we get this going? And then there's a series of exercises your pelvic health PT can take you through that can help you reestablish that muscle synergy so the abdominal wall is working easier and the
Yeah.
diaphragm isn't having to work so hard, and to
Yeah.
kind of do that. But the biggest thing is like what feels good, because people know, they know,
Mhm.
they can tell you, they don't want to, but they know what makes them feel bad.
Yeah.
Yeah. And then the final thing on that bloating, a lot of people think that, and I hear this story a lot and I see it a lot. After I go exercise, I'm really bloated.
Mhm.
And so what's happening is that they are already taking a system under stress,
Mhm.
and they are throwing gasoline on the fire.
Mm.
And so the hormone that we have, the cortisol hormone, softens the belly.
Yeah.
And so that maybe that the exercise they're doing may be okay. Maybe it's the wrong time of the day.
Yeah.
Like, or you go, after pulling their hair out all day long, then they're going to go do this other thing, which may have served
Yeah.
them well when they were 19,
Right.
but it's going to, where's the balance in there? Can they do it in the morning? Do they have the
Yeah.
same response if they go in the morning to exercise or in the middle of the day or something else?
Yeah.
Or are they exercising too hard?
Yeah.
They need more balance. Like, okay, so how often are you doing this particular thing that you're doing every day? Well, where's the balance in that? Because it's
Right.
all about balance at this stage. And
Yeah.
so can you do this one day and do this another day?
Right.
Or something else? Like what can change here? Is it time of day? Is it type of exercise?
Right.
What is it? And what can we do to begin to help them find that balance in there?
Yeah.
And that can oftentimes be very helpful for them as well.
Yeah, I think that's a great point, just because I think stereotypically people tend to think, oh, it's something I ate, or, I
Mhm.
hear a lot of moms, especially in those first couple years postpartum, talk about their afternoon pregnant belly, that they,
Mhm.
just have this large bloat in the afternoon and can't quite figure it out.
Mhm.
And I know most of them aren't thinking of kind of activity wise, what they do. They're mostly focused on, oh, well, I must have eaten something for lunch, or I must have had something for breakfast that my body just doesn't agree with.
Mhm. Or
Um,
they're running a high physiological stress index in the background. And they're just, and because many people with trauma even will tell me, "Oh, I'm over that. I've done all the work on that." And it's like, "Oh, don't think so." Hmm.
Yeah. Yeah. No, and I think I mean, that we could do a whole separate podcast on that. Like, I just feel like there's so many different things that run in the background just as a parent, not even in, looking at the outside world right now, but just navigating all of the challenges as a parent of a baby, a parent of toddlers. Now that I've got a tween and a teenager, like that's a whole nother grenade that comes home from school, and helping them study and prepare, and looking ahead at high school and all of that. Like, there's just constant background stuff
Mhm.
that runs that I think in some ways we're gaslit a little bit, in that we're like, oh, well, this is just what happens, just deal with
Yeah.
it.
Yeah.
But no, these are very legitimate stressors, like, and then throw us into, our daily lives and our work, and, what's going on in the rest of the world. Like, it's not a small, you know.
Right. And I think the story that a lot of people will say is that, I'm not stressed. Everything in my life is good. That's not that stress does not have to be adverse.
Yeah, that's true
Right?
too. Yep,
It's
that's fair.
seriously, it doesn't have to be adverse. Everything in your life could be good. It's physiological stress we're
Yeah,
talking.
that's fair too.
Mhm.
Yeah,
And
no,
it gets
just
set up there with other things that happen, and it doesn't reset
right,
down unless we make it do it.
right.
So if you're running with a high stress-o-meter, even though your whole life is fabulous,
Yep.
you still need to bring that down.
Yeah,
And we have to intentionally do that because it's not gonna just reset on its own. It doesn't do that.
yeah,
It's meant to be efficient, and if you needed it that way before, it's gonna stay there because you're probably gonna need it there again.
right.
That's how that part of our brain works. It doesn't listen to reason. It doesn't care about reason. It cares
It
about
doesn't?
keeping you alive. No, that's the part that cares about reason is a whole different part of your brain, and that's where you need to be living.
Yeah,
Mhm.
no, we're gonna have to have a whole nother podcast on that.
Absolutely, that'd be fun.
All right, as we wrap up, we have a bunch of questions that we ask at the end of each episode. First one, what's a book you're reading or podcast that you're listening to right now?
So the book I'm reading, where is it? A Spark from Fire. It is Judaism archetypes. It's like
Oh,
psychological, the Freud's guy. I can never say his name, but anyway, that's one of the books that I'm reading. I'm also reading Wind Woman from Lynn B. Andrews right now, which is
Okay.
just learning to be still and listen to the wind and the breeze. So on those little journeys of my own. And if anybody hasn't read Braiding Sweetgrass,
Oh, I've seen that one float around.
mhm,
That's a good one too?
it's a good one too. And
Okay.
I will just say, if you don't want to read the whole book, I understand, but read the story about the differences in culture's origin story.
Mm,
Your life will make a lot more sense.
okay. Gotcha. All
Hmm.
right. You've been a mom for a long time.
Yeah.
I usually ask people favorite activity since becoming a mom. I'm going to alter this for you because you've had a move in the last several years, moving from Pennsylvania up to the upper Midwest. What's your favorite activity now as a mom in the upper Midwest with adult kids?
My favorite activity as a mom, far away from her adult child and from her, all of our kids are around the same age. They're all young
Mm-hmm.
adults. Is being able to visit them and see them and, travel and having the freedom and time to travel a little bit more for more pleasure and less work.
Yeah.
So that's my favorite activity. And then
You were,
the other thing that I'm doing is, I think I mentioned it earlier, I'm painting
I
and
love
doing
that.
now, so which I never had the opportunity to explore before, and I do now. So it's been fun.
Did you paint as a kid in high school or anything or no? Oh, interesting.
Yeah, this is
I
all something that's come out of all the work I've been doing over the last 5 years.
That's
It's
super
like, I
cool.
can paint. I can, it was a story I told myself that I couldn't, and it was like, I can do
Oh,
it.
interesting.
Hmm.
I dabbled in it a little bit in high school. I quit playing the clarinet because I just didn't practice, I'll be honest. And so I had to do something else. And I picked up art and drawing and painting, and it was so much fun. And I really enjoyed it. And I was decent at it. And then unfortunately, my art teacher, she's like, oh, do this big canvas. And it was literally like an 8 foot by 5 foot canvas. And she wanted me to paint this like pile of vegetables, including like celery, and she kept it in the fridge, so it was like constantly dying. And just I was like, nothing like that to kill somebody's creativity.
Right. I don't want to paint dead food.
So I got to put a pin in that. And you're always my inspiration of things that I want to pursue once the kids are out of the house. So I'm going to put a pin in that, and I'll come back to it later. I love that. All right. And what's one piece of advice for moms, no matter kind of what age and stage?
Hug your kids 3 seconds longer.
Oh, that is an experienced mom move right there.
Hold your kids 3 seconds longer.
Yeah. Oh, you're going to make me cry. Yeah. Okay.
They'll remember, and that'll be the things you remember.
Ooh, okay. You hit something there, Susan. I think because we're looking at high school next year, and we're on 4 years, and my baby, which I mean, you've known me since before my baby. Like, no, we will hug him a little longer when he gets home today. Okay, I have a to-do list for you. I got to chew and I got to hug today when I get back.
Two very easy things to do because you do them all the time.
Yes, I can do that. I can do that. I love actionable things. All right. Who's somebody, and it doesn't necessarily have to be pregnancy, postpartum. It can be GI. It can be just like somebody that we should be paying attention to right now that you are just loving to fangirl over.
I have to say, and I go back to it all the time, I really like the work by Penny Simpkins.
Yes.
I just do. And she's
Yeah.
a gift to all of my people who are going through pregnancy and childbirth, especially the first time. And I would have to say, if you have not checked out her book for partners, that's a lovely gift to give to people.
Yeah.
The partner in the experience, whoever they may be, needs support too.
Yeah. If you guys don't know who Penny Simpkin is, we just lost her in the past year, I think it was. She was a physio, but also kind of the mother of the doula profession. I got to meet her at one of the Academy conferences in Baltimore, and she needed a ride back to Arlington. So I didn't realize who she was and her like significance in our universe at the time. So I drove this cute little lady back from Baltimore to Arlington, not realizing who she was. And now I'm like, Oh, wow. Penny Simkin was in my car for an hour. She's pretty amazing. So unfortunately can't have her on the podcast, but definitely,
Yeah.
you need to check out those resources if you haven't read any of Penny's books before. And then last question for you. What does it mean for you to be an active mom?
It means for me to be an active mom that I will have the energy to do all the other things that I'm doing too.
Yeah.
So,
Yeah.
and the word active for me means balance.
Yes. And you're such a lovely example of kind of what you've done to kind of strive for that in the time that I've known you. And, obviously now that you've got adults, kids instead of little ones. But yeah, I love that word balance. So find your balance, chew your food, hug your kids. I think we're going to finish on that one. If you guys want to learn more about Susan, you can find her on Instagram. And you do, just so you can do a quick plug here, tell us a quick little bit about what you do kind of professionally and how you help patients and professionals.
So for the healthcare professionals out there, I have a pivotal coaching program where we work with you to leave your imposter syndrome behind, step out of that deep self-critic and be the healer you've always wanted to be. Find the balance in your life along your health, your wellness, and your ability to thrive in our healthcare system versus survive. For everyone else, I have individualized coaching packages for what may be going on with you for health, wellness, and movement. And for those particularly in the perimenopause to menopause journey, I have my pinnacle coaching where we don't talk about menopause. We talk about living decades on the pinnacle of your life. What do you want it to look like? Who do you want to be? How do you want to create it? Because our perceptions are our reality. So if you can dream it, you can do it.
Love that. Love that. And if you haven't figured this out now if you're listening here at the end of the podcast, Susan is a wealth of information talking about so many different things. So if you're interested in learning more about her offerings, you can get in touch with her on Instagram. And then I think she'll also be at Pelvicon this fall for any of the physical therapists or pelvic therapists that are attending that. So if you don't know her, definitely get to know her because she's got so much information. So Susan, thank you so much. I'm so glad we got a chance to chat. It's been far too long. And I'm sure we'll come back to some of these other bigger conversations. So we'll have to have you back on the show. But thanks for joining us.
Wonderful. Thank you.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.